We'll begin this hour with some great news. Finally, the Federal Capital Territory Administration, through its Primary Healthcare Board, will be introducing an additional vaccine called Rotavirus vaccine into the routine immunization for the prevention of diarrhea in children. Well, rota diarrhea disease caused by rotavirus is mostly common in infants and young children aged 3 to 35 months, and older children can also get sick from rotavirus. Well, rotavirus has been described as one of the best ways, that's the vaccine now, the best ways to protect children against diarrhea.
While emphasis for the need for nursing mothers to maintain good hygiene, wash your hands thoroughly as well as that of the children to prevent diarrhea, the rotavirus vaccine, which was first approved in 1998, has been inaccessible to most nursing mothers due to its high cost. But this is about to change. And
joining us now for more is Dr. Eduardo Celades. Well, he is UNICEF Nigeria's Chief of Health, and I'm excited to have this conversation. Eduardo, good to see you again. I remember the last time you were here, you joined us in the studio. You actually spoke about this might be happening, and I'm excited that finally rotavirus vaccine will be available for free. Talk to us about how huge this is, looking at the fact that Nigeria will lose about 160,000 babies due to diarrhea.
Right. Thank you. Thank you very much, Amaka and Chris, for inviting us here tonight. This is really exciting, as you said. Finally, we have rotavirus vaccine here in the country. Starting on Monday, it's going to be rolled out in 19 states, plus the FCT, plus Abuja. The 19 states are in the north, it's northwest, north central, and northeast. As well, the southern states, they will get it next month. As well, it will be for the southeast, south, and southwest. And this is exciting because all children under 1 year old, they will have access to rotavirus vaccine for free. Rotavirus vaccine rotavirus is one of the virus that causes diarrhea and causes up to 60 deaths of children every day here in Nigeria. So this can really make the difference to really reduce under 5 mortality.
And how is UNICEF going to ensure, and the government agencies, and governments at all levels ensure that the vaccine is not sold and given free? And what's the capacity, in reaching far-flung areas in Nigeria?
Right. So we are working as UNICEF with the Federal Ministry of Health and as well with NPHCDA to really roll out this vaccine. This Monday we are launching the vaccine, and then what we are going to do is like having fixed posts, so you can go to any public health facility to get it for free. When your child has 6 weeks, the first dose, 10 weeks, the second dose, 14 weeks, the third dose, it is for free. And even if any under 1, if you didn't get the vaccine, you can get it. But as well, we're going to have mobile teams that they are going to go to the communities to offer the vaccine for free. So that's the good thing. Like, even if you are far away from a facility, you will be able to get this vaccine.
That is really incredible, honestly, because Nigeria still has the highest infant mortality in the world, unfortunately. So, but I'm excited about this because I know that Gavi just last year had actually announced that extension for looking at its funding of our vaccines in the country. But I'm looking beyond rotavirus right now. This is incredible. When I had my son, I had to pay an arm and a leg to get rotavirus vaccine for him. And I know, some of the things that saved him from. But I'm still concerned about our infant vaccination program here in Nigeria. And 2028 is the timeline that Gavi says they will finally completely pull out of Nigeria. Are you worried about how we're going to be able to sustain vaccination, especially for children, looking at how paltry our budget for health has been in the last couple of years?
So the country has doing progress, right? So we just got this week was published the last survey report on vaccination done by the National Bureau of Statistics. So Penta 3, that is our main vaccine, the coverage is 57% at this moment. 3 years ago was only 50%. 6 years ago was 30%. So the country has been improving.
There is progression.
That's progression.
And you think with the absence of this other agency or donor in another 5 years, it's not going to affect that progression?
No, could affect. So
how are you going to block it?
So what we need to do is to strengthen the health system, to strengthen primary health care. So we need to invest in the foundations of the system. We need to have more health workers, to discuss with the governors to increase the budget to health. We need to really have better data. So we need to do these investments in the foundations of the health system, in primary health care, to really be able to sustain that. That's not easy. That will take time. We are now in 2022. We have the next 5-6 years. But what we are seeing is that Nigeria has this capacity to do that. And still, we need to accelerate even more, if I can say that.
Absolutely. Well, at the end of the day, vaccination is still a challenge. I like the fact that you're starting in northern Nigeria, which has been identified as a hotspot where mothers, for one reason or another, hardly take their kids for vaccination. But let's circle back to what the rotavirus vaccine is all about for people who are just hearing it for the very first time, and why it's important for a mother to take her child to get it.
Right. So Rota is the virus that causes most of the diarrheas in children, right? 50%, so half of the hospitalizations that we have is because of diarrheas, and most of them are for Rota. So what the vaccine does, you need 3 shots, you need it 3 times, but then it protects you, so you will not die of that. We are estimating that 60 children, they die every day because of diarrheas in Nigeria, mostly in the north. The vaccine is not enough as well. You need good hygiene, washing your hands, vitamin A, good nutrition. So it's not only vaccine is going to solve all the problems, but for sure it's going to help. It's going to help a lot. So we haven't seen this in many countries. Here we'll still face many challenges. For example, that many children, they don't have even a single vaccine. 18% of the children in Nigeria, especially in places like Sokoto, Zamfara, in the northwest, but as well in the north central and northeast, they don't have vaccines. So we really need to be able to reach the children, the unreached children, so we can protect them, all of us together.
Yes, I mean, it's very expedient that is done. But again, some of the shortcomings you're having could center around, poor hygiene, lack of potable waters, and the environment and the rest. How is UNICEF helping to bridge these gaps?
What we are trying to do is to work from what we call multisectorial, so to work from different sectors, to work with education, with WASH, that is water, hygiene and sanitation, but as well with nutrition, and as well with birth registration even, so to bring all our efforts. So we are trying to go to world level, to have primary healthcare functioning, to really bring everybody together and working with traditional leaders, with community leaders, with governments at the state level, and with the UN, not only UNICEF, but as well WHO and others, to work together to improve the health of children. That's not easy again, but I really think that if all of us, we have the same objective, that is to save the life of the children, what we call it the 1,000 days, since the a woman is pregnant until the children reach 2 years old. If we get that window right, we are almost right.
Then we'll be having the children, surviving and growing into
and even adults.
adulthood.
Hygiene is very important. Thank God for COVID. A lot of people are washing their hands even more, but there's still room for improvement. Dr. Eduardo Celades, we have to say thank you so much for joining us tonight on the program.